access to healthcare is still very much a big problem in many parts of Africa. And we really ascribe to the notion of health as a basic human right. And what we have come in to do as VillageReach is to ensure that people who are, on the margins or at what we call the last mile, really those underserved populations, also have an equal opportunity to access healthcare. As VillageReach, we ascribe to the notion of health as a basic human right. And we recognize that the problem is huge. What we focus on as an organization is really improving supply chain of health commodities, ensuring that those areas in the margins are able to get a good supply of essential health commodities. We have a particular focus on vaccines for children. For a long time, we know that coverage of immunization coverage has remained stagnant at about 80%. And we are really compelled by these statistics and feeling that we have to do something about it. We work on really improving supply chains to ensure that health commodities get to the last mile where they are needed. And the last mile is really for us those areas that are on the margins for a couple of reasons. It might be geographical access. They may be difficult to access for many reasons. And so we ensure that those areas really get the supplies of health commodities that they need. And what we're really trying to do around supply chain, a lot of our focus is on ensuring that children actually get vaccinated. Our statistics for immunized children have remained stagnant at about 80% for many years now. And what we're trying to do is to really think about ways to really push the needle and say, what is it that we can do through the improvement of supply chain, but certainly other means as well, to ensure that we reach the other 20% that we are missing. And so we work through the government and through also other stakeholders in the countries where we work in trying to ensure that at least supply, reaches the last mile. More recently, we have begun to not only look at vaccines, but to try and have a more holistic look at the supply chain and see what are the other health commodities that we can integrate with vaccines. So in one province in Mozambique, we've started to also not only improve a vaccine supply chain, but also partner with MSF to ensure that we also improve ARV distribution. In the Congo, we've also started to improve vaccines supply together with family planning products. So these are some of the ways in which we are trying to innovate to ensure that we improve many health products so that the people at the last mile have access, equal access as everybody else.